Good evening. We are here in the studios of Mendocino Access Television, or MATV, in Ukiah, California. I am Don Popowski, a retired IT professional. The purpose of this panel discussion is to inform the general public the need for a winter shelter for the homeless people for this coming winter 2015-2016 and how this can be accomplished. You panel members are, from left to right, Judy Albert. She is the program manager of Project Sanctuary. They provide emergency shelter and support for women and men who are being abused by their partners. Sharon Govern is the administrative director of Redwood Community Services of Ukiah. They provide specialized care and services to foster children and their families. Joanne Brewer is a case manager at McCavan. Libby Guthrie is the executive director of McCavan, or Mendocino County AIDS and Viral Hepatitis Network. McCavan provides services and comfort to persons and families affected by HIV/AIDS, hepatitis C, and co-occurring disorders of mental illnesses and substance abuse. Marlene Korowski is the executive director of Plowshares. Plowshares of Ukiah provides free, hot, nutritious meals open to all every weekday year-round. Their mission? That no one in our community goes hungry. Next to Marlene is Aolin Vincent DePaul, or as he prefers, Oli. At the end, we have Judy Popowski. She is McCavan's Board of Directors chairperson. So, from each member, from each of you, and I'll start with Judy at the end. What is your relationship with you and the homeless people, and why are you here?
Okay. I'm here because our homeless shelter closed in April and has been repurposed, and I became part of a committee working to create a new shelter for the winter so that we don't have people sleeping outside.
I would like to take a moment to talk about Oli. He was born and raised in the counterculture of Willits, California. Since he was 14, he has been homeless off and on many times. This includes being homeless in Mendocino County, in San Francisco, and in Eugene, Oregon. Most recently, he was homeless in Ukiah, living at the Buddy Eller Shelter, returning after his graduation from the University of Oregon with a Bachelor of Science degree in psychology. In his 20s, using student aid primarily to get out of homelessness, initially, although as he says, there were times even during college that he was homeless. Following graduation, he came to Ukiah having no resources and homeless. He utilized the Buddy Eller Shelter while looking for work. He has been working here in Ukiah ever since. His first job then with Redwood Children's Services and now Redwood Community Services. Oli is an example that homelessness in most cases is not a choice, and with the proper support need not be permanent.
I was a resident of the Buddy Eller Center and kind of used it as a launching pad to get on my feet once I got to the county, and been homeless so many times in my life. I can't even remember how many times I've been homeless in my life.
Why did you become homeless?
Well, when I was 14, I moved from Mendocino County to my dad's house in San Francisco, and his wife pretty quickly kicked me out of the house, and so that was the first time.
Okay.
And then, I didn't finish school. I didn't finish high school. essentially only last grade I graduated was second grade up until I graduated college. So I didn't have much of an education, and
But you do have a college degree now?
I do now. A couple of
Awesome.
them. Yeah.
Awesome. Marlene,
All right, well, Plowshares operates a community dining room which offers free lunch and dinner to anyone who needs a meal. Now, not all of the people who come to Plowshares to eat are homeless, but we do have a considerable homeless population. If I were guessing, I'd say it was maybe about 30%. We get to know these people pretty well. We get to really like them and to understand their stories, and to think that they leave our dining room in the evening and they are unsafe and they're in bad weather and difficult circumstances is very heartbreaking to us and our volunteers.
Libby,
The question is?
what's your association with the homeless people? How do you help them? What do they come to your organization for?
Well, McCavan is the Mendocino County AIDS and Viral Hepatitis Network, but we also serve people who are at risk for infectious diseases. We also serve people with mental illness and substance use issues. And we have a drop-in center. And so during the day, we have anywhere from a half dozen to 20 homeless people who spend the day with us each day. We also have HIV care program, a hepatitis C care program, a specialty mental health program, and a variety of other case management programs. And at any time, 20, 60, 80% of our clients are either recently homeless or currently homeless. So this issue has definitely impacted our clients. It impacts our staff because, like Marlene, at the end of the day, we have to ask people to leave, and we do not know where they go.
So you're saying that you have homeless people camping out at your site during the day then? Is that correct?
Well, they use it as a day shelter because
shelter,
we have
okay.
we have a decent swamp cooler, and we have a kitchen, and we have a back porch and a yard, and so people, we try to make them feel comfortable. We would really, really like to see a place for people to be safely during the day, and we definitely want to see a place for people to be safely during the night. When people have housing, when they have stability in their lives, the other things that they need to make progress or to just simply survive, those things come together once they have a stable place to live.
What percentage of your clients would you say are homeless people?
The percentage that come to us to begin services, probably 80 to 90%. After they've been in services with us for a few months, well, it's probably closer to 90% are housed by that time. But during the transition period, where they're trying to actually get housing vouchers and find places to lease up and get supportive services on board, they have no place to be. It's even hard for us to coordinate care for them sometimes because we don't know where they are.
So if I understand you correctly, you're saying that when people come to you for your services, that eventually you're able to find housing for them. Is that correct, or did I mishear you?
It's very high priority for us.
Wow, okay.
Yeah.
High priority, but how successful are you at that?
When there are available units in our community and there's available subsidies, we're very successful.
Okay.
There's a limit in available units, and the subsidies are kind of at a standstill right now.
All right.
So.
Joanne, I know that you also work at McCavan. Fairly recently now, is that correct? Or have you been there for more than a year?
I've been there for 3 years.
3 years.
A little while.
And what kind of clientele are you working with?
Primarily homeless. I work on housing people.
Okay.
Housing specialist.
So you don't have to repeat what Libby's went through. Okay. Sharon.
Yes, well, with Redwood Community Services has the Arbor Youth Resource Center, and we serve youth who are homeless at times who come in to eat. They have nowhere to go during the day, so they will come to the Arbor periodically. We also do mental health crisis services for youth 18 to 25, and we see homeless youth in crisis often. So that's how the agency comes in contact with homeless youth.
So you deal. Can we? Okay.
Time out.
Time out. So,
Here.
to continue, I
Yes.
think we were with Sharon when we got interrupted. Anyway, I was going to ask, you work with children for the most part, is that correct?
The transition age youth.
Okay,
and
and some of them are homeless.
yes.
Where do they stay? Do you know?
Couch surfing mostly, but there are a few that with mental illness won't do that or don't have the contacts to do that. So they will camp out outside. But some of them had stayed at the shelter when it was open.
When it was open?
Mm-hmm.
Okay. How about, you said you got a program from 18 to 25, is that correct?
Yes. We have also...
You call these young people?
Yes, they're transitional age youth, and the Arbor serves them. We also have homeless youth who have been getting services through our Workforce Investment and Opportunities Act, Innovation and Opportunities Act, which is basically an employment service. But we have someone who lives in a car and actually works part-time. With youth, it's difficult for a number of reasons. We have youth who have mental health illnesses, but we also have youth who can only obtain part-time jobs, and getting housing in Ukiah for young people is very difficult.
Do you provide your services for the city of Ukiah or for the whole county of Mendocino?
Well, the Arbor is located in Ukiah.
It is.
And our housing program is in Ukiah. We provide mental health services throughout Mendocino County.
Okay. Judy, Project Sanctuary, I believe this has to do with people who are abused, is that correct?
Project Sanctuary is a domestic violence and sexual assault center and serves all of Mendocino County. We have an office here in Ukiah and also one in Fort Bragg. We also have a 24-hour crisis line, and we do have a domestic violence shelter. What we have noticed, for the domestic violence shelter, it can only house 15 people, and that includes women and children. We do serve men, but our shelter design is not really designed so that we can actually separate men and women. So if there's a man in a violent situation, we have to put him up in a motel for a night and then look for other kinds of housing that he might be able to have. And what we have noticed since the closing of the Buddy Eller Center in 2014, there's been an incredible increase on our crisis line and in our walk-ins for people seeking shelter that do not meet in any way our criteria for domestic violence, but are needing shelter for the night because of either, poverty, mental health issues, etc., but they aren't in domestic violence situations, so we can't really house them in our shelter. And also, having only a 15-bed shelter for domestic violence victims is not a very large facility. So it is normally full and filled to capacity anyway.
So have you noticed that because the Buddy Elder Shelter is no longer available, is there an increase in domestic violence because there is a bigger population than homeless people?
I haven't necessarily, I wouldn't say that I've noticed a correlation between an increase in domestic violence and the closing of the homeless shelter. Obviously, when people are homeless, they have increased stress of every kind in their lives. And, you know, what this committee, you know, when it first formed, was really to find a winter shelter for that 2014-15 year. And I know this is kind of jumping ahead, but really I think even the emergency shelter, even if it went past winter to a full-time shelter, I think what this committee would probably most like to see is a true housing first model where people are just housed and not having to stay in a shelter. Because even at the Buddy Eller Center, when it was going full force, people could only stay there for 6 months, and then they also would have to relocate or find another place to stay.
All right.
So, I mean, I feel that just as a community member, along with an agency that does work with, you know, sheltering people, but just as a community member, I want to see something more done for the people that we see, you know, on our streets and really have no place to refer them to unless we gave them a bus ticket to the coast, and I imagine their services at Hospitality Center, which is the one homeless shelter in Mendocino County, is probably being overutilized at this time.
Okay, I'm going to throw this to all panel members. And the question is, have any homeless people had particularly difficult times because they're no longer able to find shelter? Do you have any stories of people who, because they couldn't find a place to get out of the rain or a emergency shelter? Anybody want to have a story?
Well, I think we probably all got stories done. One thing that came to my mind was one of my my operations manager, her daughter works in the prison system, and she was telling me that one of our guests was picked up smashing out light bulbs. And when they asked her why she was smashing out the light bulbs, she said, "Yeah, go ahead, arrest me. I need a place to lay down." And that's pretty extreme behavior, but I can imagine that people are very desperate out there. Another thing that comes to mind is, as I live very close to Safeway, and I walked over there one evening and I saw a young lady who frequently comes to Plowshares, and she was panhandling. And I said to her, "What if you don't get enough money for a hotel room tonight? What will you do?" And she said, "Well, then I just walk around all night because I don't want to be raped." It's kind of compelling to see our guests in that situation.
Any other stories? Come on.
I know Joanne has lots of them.
Go ahead, Joanne.
There was a young woman not too long ago that was hurt pretty bad outside, and she came to us, and we didn't have anywhere to go. There was no room at Project Sanctuary, and it was probably the hardest night at work. I just had to close, and she just had to go.
Okay.
And it was, she was beaten up, and she had a black eye, and she had been raped, and there was nothing, no Buddy Eller, no shelter of any kind.
So she was beaten up, and you say raped?
Yeah.
Were the authorities ever?
She wouldn't involve.
She did not want to get involved with the police?
No. And it had happened on the tracks, and it was a really bad situation, and I think she spent the night at Denny's, awake, drinking coffee.
lack of a shelter have any impact on the ER because the homeless people don't have a place to get any kind of medical help?
People show up at the shelter and at the ER.
Okay.
And feign that they are suicidal when they most likely are not, I would say. It's pretty hard to rule that out. If someone's saying that, you kind of have to go with it, you know? But a lot of times you kind of know that it's more weather related.
All right. I'm more. I think I was trying to find out whether or not, because people are homeless and they don't have access to what I would consider regular health services, do they use the ER, emergency room, more frequently than people with insurance or health services available?
Yes. Very well documented.
Very well documented?
Yes, that the highest utilizers of emergency health care services are homeless and people who are not connected to any coordination of care. They often do not feel any kind of connection with a healthcare provider. There's a measure of intimidation, a lack of connection in general, and it's easy and simple and close. And to piggyback on what Ollie said, is that people go in there sometimes not even on a 5150, but just my chest hurts because they're going to get a place to lay down for a while. They're going to get something to eat. Somebody's going to care about them and fuss over them and take care of them. And that's a heartbreaking reality, but sometimes that's the only time people get to feel taken care of.
Okay.
And it happens a great deal.
Do any of you agencies, I don't know if I phrased that correctly, provide any kind of health services to the homeless people?
I have to say that UVMC, Ukiah Valley Medical Center, has been coming to Plowshares on Thursdays at lunchtime and doing informal healthcare consults, and in some case referring people to the hospital who need them. So that outreach is great, and I know that they're also working on a street medicine program under Dr. Mimi Doohan, but she could speak better to that than I can.
Okay.
And we participate every week at Plowshares on Thursdays doing screenings for HIV and hepatitis C, but during that interview and the counseling time, we make referrals to Mendocino Community Health Clinic, to specialty care for people who are positive for HIV or hepatitis C, and just have a connection with somebody that's an agency person that's actually helping guide them. And the street medicine thing is just getting its start at Plowshares for right now. So, but it's getting to know somebody that's typically thought of as one of those providers, and it's very, very helpful to get the relationship.
So if there was a shelter for homeless, would that reduce the impact on people going to ER or seeking medical services at one of your agencies?
Well, I think that, I don't know whether everyone would agree with me, but sometimes I've talked to people who are homeless when they come in, and I say, what do you do during the daytime? Because even when there was a shelter, you had to leave it by, I think 8 o'clock in the morning. And I think most of us know some of the favorite places in our community where people go, and the hospital is one of them, just to sit sometimes in the waiting rooms. Our local library is certainly one of them, because they've got some comfortable chairs and some reading matter. I know that people can probably go to Manzanita up at the Methodist Church.
For 4 hours.
For how many hours?
For 4 hours in the middle of the day.
For 4 hours in the middle of the day. But I mean, we see, I mean, the homeless people who are looking for a little rest and coolness, etc., use some of the public facilities on a pretty regular basis. I mean, I think they sit in the waiting rooms even when they're not going into the emergency room.
Right.
Yeah, I figured out a route pretty quick when I was living at the Buddy Eller Center, and I remember I showed an older lady who came and trying to show her the ropes of what to do in the daytime, and
Right.
basically Kohl's opens up at 8 a.m. It's the first place. It's cool, you go in there, you know, can hang out until 10. Then there's other places, what is it, Albertsons. I think it's Albertsons.
Lucky.
They have a bathroom, they're pretty tolerant, they're open fairly early, but Kohl's is the first place. Because when it's really cold at 8 in the wintertime, you know, you want to get out of the cold.
But you know,
And the
Don,
heat, too.
I think the point that you're trying to get at, which, you know, we don't need to prove it in this county, it's been proven again and again, is that emergency room services and law enforcement services in terms of dealing with the homeless is one of the greatest expenses. And if you house, not just, you know, give them shelter, but provide case management, the costs are reduced tremendously. I mean, more, I think the statistics, maybe somebody has them right here or not, but like, isn't it more than 50% of a drop in terms of serving individuals homeless in terms of what can occur if they actually are case managed and given a place?
And there are better outcomes overall.
And they're much
Better
better
outcomes.
Right, because kind of coming in on the end of that, we know that homelessness reduces your life expectancy. There was a study in the UK that said many of them were dying at age 50 because they were living outside. And it makes sense too when you think about always being exposed to the weather. So if you get a cold, it turns into pneumonia, and that certainly can't make your life easy, and it probably drives you to an emergency room. So there's a big human cost to go along with the cost of the emergency room and the police time rounding people up and the jail time when they have to break lights to get into jail. All that stuff costs us money, but it's kind of invisible because it just gets absorbed by the hospital, the jail, the police department. But we should consider it.
Do any of you have any idea how many homeless people we have in Mendocino County?
Anywhere from 1,200 to 1,400, would that?
The point in time surveys have been done. The one a year ago might have been more accurate than the one this year, because once the camping ordinance was out there, we tried to count people, and we found all the encampments were gone because they knew we were counting them and they knew that they could be cited. So I think 1,200 is probably a reasonable guess for the whole county, but it's of course in flux all the time, and you know, we know that there's a lot more than we can actually service and handle, but we have to make a start somewhere.
Well, there was a point in time count that is done and required, done every 2 years. But
Right.
part of it is also they tell you when you have to do the point in time count, and of course that's in the middle of January, and you know, so it was January 24th, and so our count did go down. They said there was 112 people residing in homeless shelters, 40 in transitional, and estimating 880 people that were unsheltered. Is what, and that was a decrease in numbers from the 2013 year. But they also found that there was an increase in those, what they call kind of subpopulations of homeless. So those with mental illness, those who are chronically homeless, those with AIDS and hepatitis, and those with substance abuse issues. So there was an increase in those numbers.
I also want to say that these point-in-time counts are every 2 years, but a very significant finding for Mendocino County, and I believe it was the point-in-time count in 2009. I might be wrong about the year, but within the last 5 or 6 years, we were second only to Detroit, Michigan for per capita homelessness. Detroit, Michigan, second. I think that's significant for a rural area in the state of California.
It didn't come from this group, but I heard that at the time of the point in time count, that there were a number of homeless people that deliberately avoided trying to be counted.
Right. I alluded to that. That's right.
Is that correct? Or you believe that to be correct?
We know that it was
We know.
because we had done some pre-planning on where we were going to count, and particular groups were planning on going to certain encampments that had been established and known, and when they got there, there might still be possessions and campsites there, but the people were gone.
We went
And-
to 17 of those sites, and
We also-
nobody was there.
Why do you have any opinion as to why these people were avoiding being counted?
Were being cited.
Huh?
They were being cited.
They were being cited?
Yeah, they were receiving.
But not by the
camping-
point in time people, though.
by the police. They were receiving tickets the evening that we did the count, and I believe that most of the people hid because they didn't want to get any more tickets.
Yeah, they were worried that somehow the police would be with us and that they would get more citations.
or that we were reporting to the police. I'm sure
Right.
that's it's not unusual that they would think that.
Oh, okay.
Because we do
Um,
have that ordinance in city of Ukiah.
How many people were served in the homeless shelter last winter?
In this last, when we did the emergency 4 months
Yes.
at Buddy Eller, they averaged 50
Right.
50 to 55 people.
Which is all they could take. So we don't
It
know
was-
how many they turned away.
It was full every time
It was
after
full.
it was known that it was
It
open
was
again.
full.
For a little while when they opened, because the opening was delayed because of the whole bathroom situation, and they were fixing the bathrooms. The county was paying for that. And then it was opened, and people didn't know it was opened.
Right.
And so at first they were thinking, oh, well, maybe everyone found a place. But no, just people weren't aware it was open. And as soon as people became aware, it was full. I couldn't get people in there. When I was trying to get people in there, they were getting turned away because it was full. So that continued the whole time it was open.
Is that true for previous years as well? They were always full?
Yes.
During the
Pretty
cold
much.
time,
Yes, when they had the 64 beds, there were many times when we would call over there to see for someone if there was a bed available, and many times they were full.
And you're saying 64 beds previous year?
Yes, previous years they had 64 beds,
They
and
had
they
s-
were full.
they had 64 beds, and the staff, I don't know if it was from the staff or the management or what, but I always assumed it was from the staff. When I was there on particularly cold nights, when it was very cold, some people would come who could not meet criteria to get even into the Buddy Eller Center, and they would let them sleep on the floor in the other buildings. I don't think that was official, but it happened, and there were a lot more people. What I noted when I was at the Buddy Eller Center was there were a lot more people on the tracks than there were in the Buddy Eller Center, and it wasn't completely full if the weather was nice, but as soon as the weather got difficult to be in, it filled up real quick.
Okay.
My
And- yeah.
my experience was that at the beginning of the month, when people would get paid, a few people would check out and go stay in hotel rooms, and that was the only
Shared.
time shared hotel rooms. That was the only time that I could actually get somebody into Buddy Eller Center.
All right. And in this past winter, were the homeless people able to stay there all day long, or did they have to leave by a certain time in the morning?
They had to leave.
Had to leave.
8.
So even if it was raining?
Yeah.
So there's Kohl's and there's Albertsons. It gets 10 o'clock, other buildings open up. There's a lot of government buildings. I remember the DMV, there was one fellow I knew, and that was his favorite place to just sit. He would sit, could always find him in the DMV. I liked to go to the courthouse. A lot of people were a little paranoid to go to the courthouse, but I felt really comfortable being in the courthouse, and I found it interesting to read in the law library. But the courthouse was open a lot, so yeah, there's a lot of public buildings.
And you didn't have a problem?
No, I actually like the
No
courthouse.
difficulty getting in there?
No, I didn't have a problem. I probably didn't look like your typical homeless person because I was pretty keen to not look that way because of the stigma that's involved with being homeless. I mean, I've been homeless a lot in my life, and there's a stigma you get. And I tried to maintain a very clean look. I tried not to be carrying a backpack around. There was, across the tracks in the Buddy Eller Center, there was this old rail car that was an old tank, and I discovered that if I lifted the top, it was empty on the inside, and I would stash my stuff in there all day. I also have a bad back, so I couldn't carry it. And that's another thing with being homeless is it's hard on your body. You carrying all that stuff all around, it is not easy on your body, and especially if you have issues. Most people do after a while. Yeah.
Which brings me to something I want to say, and I don't know if you were going to ask this
Go ahead.
later, but people, there's such a fallacy about people choosing homelessness, that people are homeless because they want to be. I mean, very, very, very few and far between, and usually very young, that might think it's a romantic idea, but people don't want to be homeless. They have issues, they have needs, they have mental health issues or chronic illnesses or very, very, very low income working people, and there's all sorts of reasons people are homeless, and it's very difficult to come up against the pervasive idea that somehow this is something that somebody deserves, or
that they're
they
lazy.
asked for it, or they're lazy.
You know,
some people have health care problems and they haven't been able to work and they don't get an income, and it just
Right.
goes on and on. There's
When I look at
million
a
reasons.
day in the life of a homeless person, it's more work than I do.
Yeah,
It's
a lot of
very
work to
hard
be
work
homeless.
to be homeless.
It is.
And particularly when you see people that are a little bit elderly pushing a big heavy shopping cart or making their way around, it breaks my heart.
80-year-old.
Well, and regarding what Libby said, there's a woman who lives near the Ore Springs Bridge, and one of the things she maintains is that some of the people there, even if the shelter is available, will not go to it. How accurate is that?
There's, again, reasons. Oftentimes many times people with mental illness have extreme anxiety around others. There might be paranoid schizophrenia. They can't be in a situation like that. It's more frightening for them than being under the bridge, and they need our help for permanent housing, just like anybody else, but they can't go to the shelter, and there's often we've offered it for you, and if you don't want it, then we just can't help you. But often if you really, really look down, if you really drill down on the key components of that person's life, you'll find that there's some primary mental health issue on board.
Okay.
And-
okay.
Yes. I'd just like
Or
to
they're 20.
mention that, there was data that was kept, on the Buddy Eller Center since, 2006. And, when it was about ready to, close and regroup into another kind of shelter, that there was a presentation made to the mental health board in terms of, who was using the Buddy Eller shelter. And, of the statistics given, and this is self-report. This is not people saying, oh, we sat down, we did an assessment. This is just the people who are using the facility self-reporting. And over 55% of them self-reported mental health issues. So and then another 50% reported substance abuse issues as barriers for them getting and maintaining housing. So if that's just a self-report, we probably can, jump it up another 10 to 15% if you're actually being interviewed and assessed by somebody to say what are some of the barriers that are keeping this person from stable housing.
And companion
And-
pets.
which, and also
Companion pets.
companion pets and not getting anything. So, we have to look at these individuals, and I do think we have to address, I think it's common. I mean, I might have that kind of response if I see somebody who's homeless and looks particularly downtrodden. I think, oh, that druggie or that alcoholic or something, and kind of make a judgment, blame them. But we have to see them and meet them as a whole individual and have some kind of resources. I think there's an illusion, because I talk to sometimes people who say, the reason we have homeless in this community is because we have too many resources for them. And no, I will hear that.
I
I
know.
hear it too.
Again,
I've heard it
again.
too many times.
And we've had this one woman walking in to our office, and I feel terrible for her. She's a woman 60 plus, definitely has mental health issues, on foot, and it's been hot, and walking down to Plowshares because she somehow can't keep it together to when the bus from Manzanita goes down there. So she'll come into our office flushed, sweating, and saying, I can't go any further, my feet hurt. And I can see she needs somebody to drive her down so she can get a meal and drive her back, and then drive her back down at night or something like that. She needs case management. And that's who is oftentimes out there. And so, we have a wonderful place, and Plowshares is an incredible resource. But along with that, to get people down there and back, and have them have if instead of walking in the heat 2 or 3 miles out of their way and say, well, hey, they can get food. And I do think that there's a kind of a sense of, we've got plenty of resources in this community.
Compared with who, though, Judy? It depends on where you're looking. Every community practically has a shelter, has some kind of community dining room, has some kind of HIV services. Most recently, when I came from Long Beach, anyone who was in an HIV program through St. Mary's Hospital had an apartment, had food stamps, and had medical care. And as long as they stayed on their program, they had that. All of that. So when I look at where I would go if I were homeless, I would get the heck out of here.
Well, sometimes we do wonder if that is part of the intention.
This has been, I believe, brought up earlier, and I think Judy mentioned it. Are there statistics about homeless clients' life expectancy and illness? Do we need to elaborate on that any further, or has that question already been answered?
I think there's more resources. With Dr. Mimi Doohan mentioned that there was a Massachusetts study done as well that said the average chronically homeless person who is out there for 5 years has a 50% chance of dying, and at the median age of 50. But I'm not that well versed in that particular study, and there are other people who are looking at that medical aspect, and I think Dr. Doohan, who ran a street medicine program before in Santa Barbara, could probably fill us in on some more of the medical statistics.
Okay.
But also, Housing First is not a new model in the sense that for years now, if you've gone to housing conferences through either HUD or other organizations, they've been promoting Housing First so that people are housed in order to receive the services they need, and that, as we were saying before, that creates better outcomes. It's less expensive in the long run for the community, and all over the nation, Housing First models are rising up. And so right now, we're just beginning to see that in Ukiah in some of the housing programs that are funded through HUD, but we don't have a lot of housing right now to speak of.
Okay. I think this was also mentioned earlier. How does Mendocino County compare with handle homeless people as opposed to other communities? And someone mentioned, well, we're next to Detroit. Do you still feel that to be true?
Yeah.
Anybody
I mean,
that
that's
feels
just
like-
sheer numbers, but
Huh?
that's sheer numbers. It's not necessarily how people are treated, but if you just want to look at the critical mass of people in a county that has less than 90,000, that we would even be talking about, 1,200 or 1,400 people, that that in terms of per capita population, that there's that many homeless. We have real challenges in our county because of its geographical, the geography. I mean, if you were in a county this size in Iowa, most things are visible, but we have mountainous areas. We have people living in encampments so far out of the smallest communities here that it is really hard to serve. It's really hard to contact people. We do have some real challenges that probably have kept our population, the per capita population, that high. And even if we had the resources right here in Ukiah and continued to in Fort Bragg and had some in Willits, we'd still have some of the continuing challenges because of the geography of our community and kind of the mentality too. We're the runaway to Mendocino County in the 60s and 70s, and a lot of that's still, happening. And people are a little bit distrustful of services and government, and there's a lot of challenges.
I also think that, we have regulations in this county that I think they were initially maybe put in to say, this is a problem, we want to get rid of this blight, but that aren't really helping, because it then does criminalize behavior that naturally a homeless person would probably do, such as there's no camping in Mendocino County unless you're in a legal campground. So they of course, homeless people are still going to camp, and where they camp is out of sight, which is along riverways and behind trees and in mountainous areas and everything like that, and that creates its own problem. Rather than perhaps the county looking and saying, let's create, a safe camping area, or let's create some safe parking. It's the same thing. I mean, the city of Ukiah recently, just this last year, passed a thing so that you can't sleep in your car. And so you have to go outside the Ukiah city limits if you're going to park and sleep in your car. Again, that's part of the, in a sense, criminalizing the fact that you're too poor to rent a hotel room, but maybe your vehicle is like your traveling house. When the winter shelter closed this last year, I mean, these are just stories I've heard from McCavan, because McCavan dealt so much with it. We have a campground. We have a campground at Lake Mendocino. They have their rules. You can only stay there for 2 weeks. Then you have to move on. So they were transporting people from one campground over to the Eel River to, far distances, because there really was no place, even if these people wanted to settle and camp someplace, there was no legal place for them to camp in Mendocino County, because we actually don't have that many legal campgrounds.
No.
Within a distance of services that they could actually receive services.
And pay for, because it's cost prohibitive for a lot of folks. And then the 2 weeks. And you can't camp there unless you have a credit card.
Yes.
So a lot of issues. Again, there's challenges that
Are there resources, communities that you can go to who have solved their homeless problem? Are there programs, government, state?
Don, I think there's examples all over the country, and some of them are more successful. Salt Lake City is a great story. You can Google it and see that they've housed a huge percentage of their homeless. Eugene, Oregon has these independent living villages where they've constructed some Conestoga huts that are weatherproof, that are in circles, and they don't have electricity and plumbing themselves, but there's a nearby facility with plumbing and so on. I mean, there's a lot of different creative things that are going on. In San Francisco, Lava May, where they have showers on retrofitted muni buses with showers that can pull up and people can get clean. There's a lot of
West
creative
Sacramento.
solutions. There's a lot of creative solutions out there. We have to begin somewhere. We've got an emergency coming up with the winter coming on, and we need to get an emergency shelter started. That is not the end of the line.
Right.
That is a funnel
Right.
towards other types of solutions. But we definitely have to start where we are.
So, if I hear you correctly, you're saying that the immediate goal is that we do need to find some kind of shelter, emergency shelter, for the homeless for this coming winter, because Buddy Eller is not going to be available. Is that correct?
It's not.
And
It's
the
not
center-
available for most of the people who are going to need it. There will be a very few beds for people who qualify for certain programs.
They're at capacity right now. Yeah, they're at capacity
So-
right now.
Well, it's I thought it was going to be a drug rehab. I mean, I heard that even the ESVP program is going to be, everyone that's in there is going to be gone within 2 months.
Oh, I don't.
That's
I
going
don't
to drug
know.
rehab too.
I don't know about that.
That's what I was told.
But I did hear today
Actually, I think it was in
that
the
they
paper.
can't take any males there, so there may be family beds still, but no males.
Yeah, ESVP
So-
is closing too.
Okay.
As far as being a shelter.
I didn't hear you clearly, but are you saying that no beds are available at the Buddy Eller Center
It's
right
a-
now?
It's a program,
It's
and
been
they
closed.
have beds for a certain clientele, but I believe are they full now?
It's a
Is
drug
that-
rehab at this point.
So-
the Buddy Eller Center.
There's a whole other segment of the population that still needs emergency housing.
Okay.
Disabled, elderly,
Mentally ill.
yeah, just any number of things that
Okay.
are not going to qualify.
Right.
Anybody that's not a
I
family.
just want to clarify something. So, if you're homeless and you need a night to stay, I'm calling it a walk-in. Are walk-in beds available?
No.
No.
Okay.
Not in a long time, yeah. There
Oh.
haven't been walk-in beds for a long time, not since the winter shelter closed, and even then there wasn't walk-in
Okay.
beds because it was beyond capacity.
So, there is an immediate need to find some place to house homeless for this coming winter.
Yes.
We think we've found some place, but we need funding. we need
That's the crux of it.
we need financial support because we do believe we have found an appropriate place, and it could be up and running by the time it's needed this winter. But we do not have. We may have maybe 50% of the startup costs.
Okay.
And that's not written in stone.
Does anybody want to do a conclusion?
Well, I think we need a call to the community that we definitely need your help. We're a small group of nonprofit administrators and staff. I know there's people out there who care very much about the homeless, and if people have available resources, particularly money, but also if there is land, safe parking spots, safe camping spots, any way that people want to help. McGavin has generously arranged to be the fiscal intermediary for the funding. So you can send money to McGavin Homeless Shelter Project, P.O. Box 1350, Ukiah, California 9548. And if you have questions, Judy, you have a phone number and an email address people can address?
Yes, you can reach me at judy@mcavin.org. That's MCAVHN.org. Or you can call my cell phone at 650-483-2997 with any questions. I will also be putting a PayPal link on our Facebook page in the next few days. So I will be able to take credit cards and Also, when we talk about needs, I want to also put out there that we currently do not have any beds, even if we had the building. And so if people have beds, bedding that they would donate, that would help us a great deal.
Okay. Well, I thank all of you for your time. It's become quite apparent to me that the people who are most in need of shelter are the ones that are least acceptable to people in society. You're mentally ill, people who are users and are trying to get better. And I am also very concerned that there is a prediction that El Nino is going to be very, very bad this coming winter and may bring lots of rain and wet weather. And I hate to see people sleeping outside in sleeping bags that are soaked. So,
This would be the first winter, I believe, Don, that we've had absolutely no solution. We've always had something, and I don't think that's acceptable. I don't think that's what the people in this county want.
anybody else want to make any final remarks?
Well, I think if there's people in the community that do want to become involved in that, they can also contact us for that as well. We really would like some more input from the community and to attend some of the meetings that we have regarding this subject.
So they could contact each of your individual agencies
They
with
could do that as
what
well.
they could do to help? Okay. So you're all open to
Absolutely, yes.